Hi, I'm Dr. Brent Reynolds, chiropractor who specializes in neurology, located in Smithtown, New York. Today I want to talk to you about vertigo, specifically benign paroxysmal positional vertigo. And that's a big fancy term for dizziness or movement of the environment or spinning when one moves their head. Basically, people report that they turn over in bed, or they lean their head back, or they turn very quickly from side to side, and they experience the world spinning around them. So there are lots of different causes of dizziness and vertigo, which is usually the word vertigo is specific for spinning sensation of the environment around them, not the person actually feeling a spin. That's a little bit different. But lots of different causes, but one of the causes of BPPV is very specific. What happens, we have tubes inside our inner ears, and I usually describe them like this to patients. So there are three different tubes, and the lowest tube sits in the back of the inner ear, and they're very small. And crystals, there are calcium carbonate crystals that line the inner ear, part of the inner ear, and sometimes they get dislodged due to trauma or just aging or for no reason whatsoever. It's idiopathic, or it's not known why they fall into the tube, and then they form a cluster. They clump together, and they don't allow the normal fluid to move. So the fluid, when we move our heads, moves inside the tubes, right? So when it moves, the fluid moves. It has a certain consistency and weight. It actually stimulates the brain to tell you you're not actually moving, and it stimulates the different pathways so that you can turn your head and not feel a spin or feel dizzy. When we have these crystals inside the inner ear, they form like a plunger effect, and they cause dizziness. They send abnormal signals into the brain, which cause your brain to think the world is actually spinning around you. So what we do to test for this is we put, first of all, we put the person on a table, and we're going to lean them back because most of the time the crystals fall into the lowest canal in the back and get stuck there. And so when they lean their head back, they feel dizzy. And it could be from side to side. People could feel it on the right side, not feel it on the left. So what we want to do is we want to induce the dizziness, and we don't want them to look at something when we do it. So we're going to lean them back off the table, and we put these goggles on. Actually, I'll put these goggles on. Turn the light on. These are called Forenza lenses, and I can't see anything through here. I can just see shapes, but I can't fixate on something right now. And what happens is the patient lays back, we ask them to keep their eyes open, they look, and they can't focus on something. Once you focus on something, you can actually cancel out the dizziness. And so what we see, and what I do with these glasses and why they're important for me as a practitioner, is I look at their eyeballs and I can see what's called nystagmus. If they in fact have dizziness, their eyes will start to ratchet and start to move like this as the crystal plug moves out and then gets, moves through the canal. The fix for this, or the treatment for this, is that we do what's called an Epley maneuver. And the Epley maneuver is where I actually move the head. We turn, if it's on the right side, we bring them back. We see that the eyes move. We see that, the person reports they're dizzy. And then when it calms down, we move their head, turn their head to the left. They sometimes will get dizzy again. The eyes will move again as the crystals are moving through. And then we actually have them, and then it'll calm down. Then we have them roll onto their left side, and with their head pointing towards the door, keeping their head below the horizon, below their body slightly, to allow the crystals to move through the front part of the canal. And then basically our goal is to deposit the crystals down into the middle part of the inner ear in the fluid, and they actually will dissolve over the next few days. We usually ask people to not lie flat, to keep their head above 45 degrees for 2 nights. And usually they're doing that already because they usually tell us they sleep with their head propped up. And usually this really is super effective treatment in a lot of cases for this. A lot of people don't know that a chiropractor who specializes in neurology does this for patients, but I've been doing this for about 10 years. I do about 3 or 4 of these a month on patients. I did one today. It was actually negative. And when that happens, when we do the test and we lean them back and we don't see their eyes moving and they don't really report significant dizziness, we move on to other things. And this particular patient today had a problem with her neck. Her neck was causing her dizziness and some of the spinning sensation. So it's not always the crystals, but we have to rule them out. And usually it's very effective. Sometimes we have to do more than once. Sometimes I've done them and they're good for here on out. Sometimes people, if they've had them for a long time, it does change the brain, the way your brain, the vestibular system or the dizzy center of your brain, the way it fires. So sometimes we have to give them exercises to do where we have to help them to stabilize their vision and their balance and things like that later on down the road to kind of help with the dizziness. So it's something that can be treated. Typically medication is given that might help for just a little bit, but usually doesn't fix the problem. And our goal, of course, with all neurological cases and every patient that we see walk through the door, want to try to fix what's actually causing the problem. So I just wanted to let everybody know that as a chiropractic neurologist, we help with this, and I see this on a regular basis, and I have for about the past 10, 15 years. Okay? All right. Take care.
Hello, today we're talking about headaches and the neurological dysregulation pattern that I see associated with it. A brain, when it's functioning normally, is able to shift gears all day long, right? So we're able to speed up when it's time to learn something, slow down when it's time to go to sleep, and maintain this sort of neutral gear when we're doing things that are routine for us. Very often we see in patients who suffer specifically with migraine headaches is that we see that they have this sped up version of their brain. So their brain is just in high gear all the time. And so what happens is as our environment changes, whether it be a little bit less sleep, a hormonal fluctuation, and or certain foods that may trigger the migraine, what will happen is that we'll have this neurological dysregulation that really plays a big part in manifesting the headache. So with brain core therapy, what we do is we train the brain to be in a lower gear. And when we can train the brain and reward the brain to be in the lower gear, people have less headaches. There's a lot of research regarding this kind of challenge, and we've seen great results here. So if you have someone in your family or friends that needs to hear this message, please pass it along, and we look forward to helping you. Bye now. Hi everybody. Today we're talking about teenage anxiety. There are a lot of demands on teenagers nowadays. The academics, the athletics, the social pressures, and some kids are able to manage better than others, just like certain adults can manage better than others. And today I wanted to talk specifically about neurofeedback and how neurofeedback can help with anxiety. You know, I've talked to you before about how the brain is supposed to shift gears, right? Speed up to learn something new, slow down when we want it to go to sleep, and then stay in kind of an idle gear when we're doing things that are routine. When kids get stuck in this anxiety, what happens is that they get stuck in these higher gears. It's called beta waves, and this is why they may not sleep as well as they should, or why they just have that constant angst. And this is really, really important to address. I hear more and more cases of teenagers finding other ways to deal with their anxiety, whether it be drugs, alcohol, cutting. I mean, I've heard so many challenges. And this is a non-invasive way to really help your kids get the help that they need. This is a tool that we can use. Neurofeedback helps to train their brain to have a different pattern. So instead of being revved up, we're rewarding the brain every time it slows down. And what greater gift can you give your kids but the ability to self-regulate themselves, right? You know, if this prolongs, then they find other ways to make themselves feel better, and it's not always the best choices. And we know that the prefrontal cortex, which is the front of the brain, really develops while we're in our teenagehood, you know? And so without that development, they're not able to inhibit their brain the way it should. So in other words, they might make impulsive decisions, and this impulsivity can really create lots of challenges for the whole family dynamic. So my suggestion is, if you have a child that's struggling with anxiety, don't wait for these other things to pop up. Address it now, address it at the source, and get a QEEG so that we can see if that's what's going on with them. Thanks for listening. Talk soon. Bye.